Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, how to get 30, how to get 20, 20, 20, how to get 20, 20, how to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
When many of us think about child hunger, our minds usually turn to other third world countries. However, the problem is right in our backyard. While policymakers often use the term child hunger, Dr. Sara Bleich says the actual issue is food insecurity, which is not having enough access to food to meet your basic needs.
So as we think about the problem of food insecurity, it's not just the fact that children's bellies are empty and therefore they have this feeling of hunger. There are a lot of very clear negative effects that come along with food insecurity. So for example, it has been shown to be associated with negative academic performance for children and even negative behavior in the classroom. It's been shown to be associated with a host of health issues like asthma and anemia. And it's also been associated with developmental delays. And so it is very much in the best interest of our entire society to think collectively about how do we meaningfully address the problem of food insecurity among children, because it has the potential to impact their future productiveness.
Bleich is a professor of public health policy at Harvard Chan School of Public Health. The USDA conducts annual reports on food insecurity in America, and their most recent numbers are concerning. After a decade of declining numbers, food insecurity is once again on the rise.
12.8% of U.S. households, or 17 million households, experienced food insecurity in 2022, which again means that they had difficulty providing enough food for all of their members due to lack of resources. This is higher than what was found in 2021. And what's also important to understand is that that's the average overall. But if you look at different subpopulations, like if you look at Black households, or if you look at Latinx households, what you find is that food insecurity among those households is considerably higher as compared to white households. So take-home point number one is that in the most recent survey, the decade-long decline in food insecurity has begun to go up again, which is very concerning. And take-home point number two is that we are seeing persistent disparities by race in food insecurity levels.
After seeing declining numbers for a decade, what's changed in the last couple of years to reverse all the progress? Bleich says one key factor is that certain enhancements to programs like the Federal Nutrition Assistance Program weren't continued after the pandemic.
The expanded child tax credit expired at the end of 2021. Universal free meals for children at school expired in the summer of 2022 in June. And the Supplemental Nutrition Assistance Program, which is known as SNAP, had for a period emergency allotments during the pandemic, and those expired in February of 2023.
And as these resources have ended, we've also seen a rise in food prices. Even though supply chain issues have been resolved, the cost of groceries remains much higher than in recent years. In an effort to end hunger and obesity in America, there are 16 federal nutrition programs. Bleich says the data is indisputable that these programs are very effective. And in light of the rising numbers of households experiencing food insecurity, there's a brand new program this year called Sunbucks. Cindy Long, administrator of the USDA Food and Nutrition Service, explains that Sunbucks give low-income families extra money to buy groceries.
The Sunbucks program, which is what we're calling the EBT program, has been piloted for about the last decade or so in a number of communities around the country. And it has been found not only to reduce food insecurity in the summer, but also improve nutritional quality in ways like increasing the amount of fruits and vegetables and whole grains that are consumed with the benefit.
The EBT program gives families $120 for each eligible school-aged child. It's a new addition to the SUN programs, which offer both in-person and to-go meals. The in-person meals are served at local schools, parks, and other community locations that also offer activities for the kids. It's been in effect since 1968, but the to-go meals were just launched in 2023 to reach the families who live in more rural areas.
And it allows meals to be either picked up or delivered, because we know from experience that in rural areas, transportation, scheduling can make gathering in a group challenging.
The USDA has been testing out the Sunbucks program in several areas for the last 10 years, but this year it will be available across the nation. Each state chooses whether to opt into the program, and there's currently 45 states, territories, and tribes participating.
We are just really pleased that Congress structured the program in a way that tribal communities can participate, because we certainly do know that food insecurity is a significant challenge in many tribal communities, and many children rely on free and reduced price meals during the school year, which is really what these programs are trying to replicate in the summertime.
Earlier, Bleich mentioned that food insecurity disproportionately affects minority populations. However, there's not a lot of research about how American Indian and Alaska Native communities are impacted. But what little we do know shows that they have a higher risk of food insecurity. A 2022 scoping review published in Advances in Nutrition estimates that up to 45% of people in these communities experience food insecurity. Thankfully, Bleich says these food programs, which serve millions of children, truly do reduce the issue of food insecurity.
So just SNAP has been shown to reduce food insecurity by about 30%, WIC by about 40% among women who are postpartum. So there's a large evidence base we can draw from when it comes to effectiveness.
While financial support is only part of the solution, it is a huge piece of the puzzle. It's true that the average American diet includes a lot of ultra-processed food, but it's also true that the healthier organic options come at a premium that many families can't afford.
What's pretty clear is that parents generally, regardless of income level, want their children to eat nutritious food. The reality is that income constraints can make that hard for many families. And so they have to make tough choices. Sometimes those choices are between more nutritious foods and less nutritious foods. Sometimes those choices are between buying food at all and paying bills.
And while poverty is a main driver of food insecurity, it's not the only factor at play. Housing issues can seriously impact a family's ability to store and cook quality food.
You just imagine if you're trying to eat a healthy diet and you don't have access to a reliable kitchen, or you have a kitchen, but you don't have access to a reliable stove, or you don't have pots and pans. There are real life constraints that just make it very hard for people to do the things they want to do, even if they know the right thing to do.
Another challenge is the access to healthier options. There are places across America where it's difficult to purchase affordable, high-quality food, which are called food deserts. And many of these food deserts are in minority neighborhoods. A 2021 study in BMC Nutrition shows that these populations are significantly more likely to have to travel farther than non-minority groups to access quality grocery stores.
So even if you have the resources, if you lack then the ability to purchase food that is nutritious, it creates barriers. Now, built in to the nutrition assistance programs are attempts to help both provide resources to purchase food and at the same time provide education and broader supports to encourage families to make healthier choices. And this is something that takes time. People are always making trade-offs, and so it's not going to always happen exactly the way that it should. But one really important thing to remember is the nutrition assistance programs are very large. They serve tens of millions of people, but they alone cannot solve the problem. If we really want to address food insecurity, we have to look at the problem of poverty, and we have to look at the problem of housing.
Bleich notes a few strategies that could address these two root causes. The first is extending the expanded child tax credit. It will give more credit to the 19 million kids who currently get partial or no credit because their parents' income is too low. The House of Representatives voted in favor of it in January, but it's been stuck in the Senate ever since. However, Bleich says there's more than enough reason for Congress to pass it.
There is very strong evidence that helped lift children out of poverty, but that has obviously sunset, and that is likely one of the reasons why we're seeing an uptick in food insecurity. A second is that existing programs, which we know to be effective, are not fully utilized. So if you look at WIC, for example, women, infants, and children, only about half of those eligible participate in the program. So there are a lot of efforts right now underway by USDA, the U.S. Department of Agriculture, to help improve uptake of the program, but it's going to take time. And we need to look at the resources that are currently available and really try to maximize participation.
With the rising rates of food insecurity in America, it's important that we figure out these issues now so that we're not leaving millions of hungry kids to fend for themselves. You can find out more information about the Sun programs and all of our guests at radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.